Health Talk brought to you by Rapides Regional Medical Center. Any third-year med student would have diagnosed the problem immediately, but in this case, it took Dr. Jonathan Hunter a bit longer.
Yeah, my symptoms began in November with fever and night sweats and fatigue, and had lost my appetite. Generally, those symptoms you would think are due to some viral illness. So naturally, I thought that in the first week or two.
And that's when he began looking at other options.
There was something going on here more than just a simple viral infection. I was discussing this with my partner and friend, Dr. Brunson, and she agreed with that and happened to just walk over and put a stethoscope on my chest. And she asked about this large heart murmur that I had, and I don't have a heart murmur, had never had a heart murmur. So she very quickly took the little earpieces off and put them on mine. And it was this loud roaring murmur, and I knew, as any doctor would immediately know, that's probably endocarditis.
Hunter discovered his heart murmur was a result of a malfunctioning heart valve, a dilated ventricle, and atrium.
Well, Dr. Hunter actually had two diagnoses. He had infective endocarditis of the mitral valve and severe mitral valve regurgitation. And we had a pretty good idea from the echocardiogram that a repair might be feasible. And fortunately, when we actually saw the tissues, we felt like a good repair would be possible.
8 weeks later, after a traditional open incision valve repair, Dr. Hunter is back at work and feeling great.
My colleagues that I work with, I have every confidence in. I knew that they could take care of this. They've treated me well and honored me and my family, and I'm as grateful as you could be to have gone through this and come out through it well.
For more information about the region's most advanced heart care, visit rapidesregional.com.